Well, all right, we're here with Dr. Planty today, optometrist from Baytown, Texas. Dr. Planty, hi.
Good evening.
Good evening. Dr. Planty, tell me, what would you say is actually, one of the main concerns, the main thing people neglect when it comes to their eyes? There must be something, which we all kind of like wash under the table, like with many other illnesses, and when we then find out that we have a problem, it sometimes is too late. What would you say are the one or two, main things as people neglect?
I think one of the two main things is the fact that people just really don't believe that they need to update their prescription to be able to see correctly 100% of the time. I think the other aspect is the fact that they don't believe that going to the eye doctor will uncover health issues like diabetes, glaucoma, high blood pressure, things like that can actually help them extend their lives.
Interesting. Now, why would an optometrist find out, let's say, diabetes when every other doctor apparently supposed to find it too? For instance, I work with a lot of podiatrists, and they're like diabetes specialists. So what is it in the eye which makes seeing it maybe apparently a little better and faster than some other doctors? What would that be?
Well, part of our visual examination required by law is for us to do an eye health evaluation where we look inside the eye, and that is the only way that anybody can actually see blood vessels inside the body is through the eye. So we're able to observe the blood vessels, and in diabetes what you have is blood vessels that break, and they're leaking blood all over the place. With high blood pressure, what you see is where the pressure kind of just forces the blood out of the veins and the arteries, and it leaves a mess on the retina. We can pick this stuff up even before your doctor realizes that there's high blood pressure, or even that the blood glucose levels are up or elevated to the point to where they go into comas or they faint or all those other sort of symptoms.
I see. Well, it makes somewhat sense to me now that you mention it, because very obviously the eyes are rather fragile type of thing. And so that the blood vessels burst or whatever it may be, then on a technical thing, I don't try to get technical here, that is visible easier or faster in the eyes than on a big elephant skin, even on the toe or somehow, makes sense actually.
It does.
Okay, good. Now, what about, you said the other thing was about updating the prescription. Let's take a guy like me. Here I am, 58 years old, and I wear 99 cents eyeglasses for reading if needed. But if I'm reading outside in the at Starbucks in the nice sun, I actually kind of don't need them. But the second it gets a little darker and I work on my computer in here, I actually need them. Now, very obviously, I have no examination. How do I know that I do use the right thing and not hurt my eyes?
The only way you're going to know that is to go to an eye doctor and have that figured out for you. But something is better than nothing, and the magnifiers do help for those individuals who have issues reading up close. The reason that you see better outside in the bright daylight is because in the bright daylight your pupil goes very, very small. Just like in a camera, the shutter goes real small, you increase the depth of focus, you're going to end up seeing a lot sharper and crisper. At nighttime, the pupil has to dilate to allow more light in to be able to see. Therefore, now it's counterproductive to clarity at that particular point. So you'll have issues at night that you won't have during the daytime. And classic sign for anybody who thinks that they have an issue is the number one reason is night blindness or nighttime seeing or dark seeing is where they always come in and complain. They won't have any complaints if they're just working in the daylight.
I see. So what are some of the effects, the negative effects which might happen if my eyes are, so to say, out of focus and need a different type of glass than I'm wearing, or at different times kind of stuff? If I kind of like go too long with straining it and say, I'm all right, what could be some of that effect?
Well, some of the effects are basically headaches. You'll end up getting headaches when you strain too much for too long a period, working on a computer or trying to focus on anything intently for any amount of time. So headaches are probably the number one reason. Number two is productivity. Your productivity goes down because there'll be periods of time where your vision is clear, and then there's periods of time where it goes blurry for you. So it kind of comes in, goes out, comes in, goes out, and you kind of get a little aggravated with that. Stress level goes up a little bit. Everything goes out of focus. You quit doing what you're doing, take a break. So you lose a little bit of productivity at that point.
I guess. Okay, I got it. And of course, I guess when you're on a traffic light at night and things look a little funny and there's like 3 different places you could go and you don't know where to go, a little fender bender is probably around the corner. So maybe, maybe I should get my butt to an optometrist. Well, all right, Dr. Planty. Thanks for telling us that. I'll be speaking with you more. Bye-bye.
Thank